Every kid who coughs and wheezes isn't always an asthmatic. There are other conditions that can almost look like it. Sometimes the doctor sends a kid to a gastroenterologist, not an asthma specialist, for a kid coughing. Why is that?
It's a very good question. What we've learned, as you've stated, is that all that coughs and wheezes is not asthma. And it's dangerous to make the assumption that this patient has asthma just because you hear wheezing. If the patient has other symptoms, if the patient does not seem to respond to asthma medicine properly, or if the patient's lung function tests do not give you the characteristic picture of asthma, you need to look for other conditions that can look like asthma. One of the most common conditions we see that looks like asthma is gastroesophageal reflux, sometimes known as acid reflux. This disease is diagnosed both by the pulmonologist, but even more commonly by the gastroenterologist, the stomach doctor. Gastroesophageal reflux is a condition whereby the valve that separates the stomach from the food pipe doesn't work effectively, and so the acid in the stomach has a tendency to come up into the food pipe, into the back of the throat, into the nose, sinuses, and may even leak down into the lungs. Once this acid is in this area of the body, it leads to irritation, inflammation, coughing, and sometimes even wheezing. If we give asthma medicine to a patient with gastroesophageal reflux, it might even make that condition worse. And so it's important that we use the proper medication for the proper disease. Medications for gastroesophageal reflux will treat the reflux, eliminate the acid, and allow for the rest of the area to heal, thereby improving the cough and wheezing without even needing other medication.
Are there some kids that can have both conditions at the same time?
You absolutely can have both conditions at the same time. Severe asthma can lead to reflux, and severe reflux can lead to asthma. So there are occasions where you need to be on both asthma medicine and reflux medicine. In that case, it takes expert coordination in order to minimize the side effects of these medications and maximize their benefit.